Good afternoon, and thank you for joining our briefing on the City of Philadelphia's response to COVID-19. Today, all of our speakers are joining the briefing virtually to adhere to social distancing guidelines. We will begin our briefing today with opening remarks from Dr. Tom Farley. Dr. Farley, you now have the floor.
Thank you very much. The news from the coronavirus is not very good today. Cases continue to rise nationally and regionally. And because of that, we will pause some of our reopening plans until it is clear how much of this is going to affect us here in Philadelphia. Let me give you some background starting first with numbers. Since this time yesterday, we've had 142 new cases of the coronavirus infection diagnosed in Philadelphia residents, bringing us to a total of 26,133 since the beginning of the epidemic. Now, in the past couple of weeks, our cases are more likely to be younger people, such as teenagers and young adults. In the past 2 weeks, 34% of our cases have been under the age of 30 versus 20% for the epidemic as a whole. To the extent we can understand where this is being transmitted among young people, it's been linked to social events and to travel, and particularly travel to the Jersey Shore. Since this time yesterday, we've confirmed 5 additional deaths from the coronavirus infection, bringing us to a total of 1,584 since the beginning of the epidemic. Now, our daily case count is no longer falling. For the week that ended just last Saturday, there were a total of 740 cases that were reported to us. So an average of just above 100 per day over that 7-day week. That's 740 is an increase from 725 the week before. Not a big increase, but that is an increase, and it's a change from what we were seeing before that. Elsewhere, this epidemic has signs that are even worse. Case counts in the U.S. as a whole over the past 14 days have risen more than 80%. Case counts are surging in Florida and Texas. These are states that had initially peaked at about 1,000 cases per day, and now are seeing more than 8,000 cases per day. And the rise is not just a steady rise, but in fact it's accelerating. Closer to home, we're seeing case counts rising in the entire state of Pennsylvania, in New Jersey, and in Delaware. And we're seeing a surge in cases in Allegheny County. Now, the outbreaks in other states are linked in particular to social events and to restaurants and bars. These are places where people are close together inside and not wearing masks because they're eating and drinking. This has prompted states of Texas and Florida to close bars, and similarly, Allegheny County has closed indoor drinking. New Jersey has postponed what they had scheduled before the reopening of indoor dining at restaurants. Back here in Philadelphia, unfortunately, the targets we laid out to go to green will not be met by this Friday. We have not had a steady decrease in cases over 4 weeks, and our daily case count looks like will not be below 80. Our response to this includes what we discussed last Friday. We're reminding first businesses and activity managers that they are required to enforce a variety of safety precautions, including distancing among people and mask use. A mask media campaign, which will launch very soon. An executive order that we passed last Friday requiring people to wear masks when they're indoors in public places or outdoors within 6 feet of other people. A recommendation that people in Philadelphia not travel to high incidence areas, and that people traveling from high incidence areas coming to Philadelphia self-quarantine for 14 days. There's a map that's posted on our website that indicates what are the states that we consider to be high incidence areas. An additional step we're taking as part of this precaution is that we will not be allowing restaurants to permit indoor dining as of this Friday, which we had tentatively scheduled before. Now, there are 4,200 restaurants in Philadelphia that have indoor dining under ordinary circumstances. If we would allow people to congregate in there without masks, that might catalyze another surge in cases. It could be as bad as we saw here last April or worse. It could overwhelm our hospital system. It could increase deaths. And to prevent that, it could force us to shut down again. We think it's better for us to be cautious now than, like Texas and Florida, open up restaurants and regret it later. We still will allow restaurants to allow delivery and takeout and outdoor dining. We will also put a pause on reopening gyms and fitness centers. This is because there's evidence that vigorous physical activity that causes you to breathe fast puts people nearby at risk. And now there's no one that promotes exercise that is more interested in exercise than us here at the health department. We're very enthusiastic about exercise, but we'd encourage people to get their exercise outdoors. Now, we will pause these activities until August 1st, but we'll reevaluate weekly based upon the trends in the epidemic across the nation as well as locally to consider whether there's any reason we might want to reopen them earlier than that. Other than that, we will move to a modified, restricted version of green as initially laid out by the governor. We will allow some of the lower risk activities that were included in green. And those activities tend to be outdoors or where masks can be worn and enforced. That includes museums and libraries. It includes indoor shopping malls. It includes the city's casino, but only under very strict safety requirements, requiring people to mask at all times, requiring people to maintain a social distance of more than 6 feet at all times, and absolutely no food, no drink, no smoking indoors. And outdoor gatherings of up to 50 people. These are things that will be allowed starting this Friday. All those activities must follow our safe mode guidance. Remember, there are 8 items in the safety checklist for that safe mode guidance that includes, most important, masks. It also includes steps to reduce crowds, to enforce distancing between people, to put barriers between people, such as those plexiglass barriers you see at cash registers, and other steps. Now, we have been working and will continue to work directly with schools and colleges around their reopening plans to ensure that they're going to be safe. And we continue to recommend that everyone who can work remotely continue to do so. If you can stay safe at home, this is still the time to do it. And I want to make very clear here today that if cases rise here in Philadelphia, it is possible that we will have to backtrack and close activities that we are currently allowing or that we are starting to allow reopening as of Friday. Now, the big picture here, if you think about it, is that it's clear we will be living with this virus for a long time. We will not eliminate it here in Philadelphia. We'll not eliminate it nationally. We'll not eliminate it regionally until we have a vaccine. Fortunately, most people who have this infection have a mild infection or they recover. And fortunately, our healthcare system is more experienced now than it was a few months ago in how to treat this infection. If we can't eliminate this virus, we have to do everything we can to protect the people who are most likely to have a severe case, the people that we call our vulnerable populations. That gets back to the third part of our strategy for combating the coronavirus. There's 3 parts of our containment, social distancing, protecting vulnerable populations. Now, we will continue to work and have been working with nursing homes and other congregate care facilities to prevent spread in those facilities. But many vulnerable people are living at home. And so I want to emphasize the importance of those people of staying safe. People who are considered to be vulnerable at home are people over the age of 65, people over the age of 50 who have diabetes or another chronic illness, or people at any age with an immune deficiency, such as people who have undergone cancer treatment. Our recommendations for them are, don't let COVID into the house. Stay home, don't go out for errands, and don't allow your household members to pass on the infection to you. So your other household members should stay home as well as much as possible. And when you're around your household members, if they've been out of the house, you should wear a mask, and your household members and caregivers should wear a mask as well. More information on our reopening plans, more information about the epidemic, it's all on our website at www.phila.gov/COVID. I'd be happy to answer any of your questions. Thanks.
Thank you, Dr. Farley. We are now going to turn it over to Armando, who will deliver a Spanish language translation of Dr. Farley's remarks.
Actualización en materia de salud y algunas consideraciones sobre la transición a la fase verde para el día martes 30 de junio del 2020. Buenas tardes a todos. Los casos continúan aumentando a nivel nacional y regional. Primero, les anuncio las cifras para el día de hoy. Se han reportado 142 nuevos casos con un total de 26.133 casos acumulados. Lamentablemente, reportamos 5 fallecimientos el día de hoy. El total acumulado de muertes por la COVID-19 es de 1.584. El número de casos en nuestras comunidades no ha disminuido. Desde la semana pasada, el promedio es de más de 100 casos diarios y este número está aumentando poco a poco. En todos lados, las señales demuestran que la epidemia está empeorando. En los Estados Unidos, el conteo de los casos ha subido aproximadamente en un 80% desde hace 14 días. Y los casos van en aumento en estados como Florida y Texas, que han pasado de 1.000 casos diarios a 8.000 casos por día. No solo se ha evidenciado un aumento, sino también una aceleración en el ritmo de los contagios. y lamentablemente el número de casos va aumentando en muchas regiones de Pensilvania, Delaware y New Jersey. Se ha producido una oleada de casos en Pittsburgh y en el condado de Allegheny. Los brotes en otros estados están asociados a la reanudación de actividades sociales en restaurantes y bares. Estos son lugares donde las personas están bajo techo juntas y no es posible usar las máscaras todo el tiempo. Al igual que en Texas, el estado de la Florida cerrará los bares. Nueva Jersey también pausó la reapertura de restaurantes. Posiblemente nosotros no alcanzaremos las metas que nos habíamos planteado para pasar a la fase verde para este próximo día viernes. No hemos visto una disminución en el número de casos en las últimas 4 semanas y el conteo diario de los casos no ha sido menor de 80 casos diarios. Como lo conversamos el viernes pasado, esta es nuestra respuesta ante esta contingencia. El recordarle insistentemente a los negocios, sus gerentes y supervisores que deben hacer cumplir con el uso de la máscara o cubierta facial en sus establecimientos. El desplegar una campaña informativa sobre el uso de las máscaras. El emitir una orden municipal que norma el uso obligatorio de máscaras en espacios abiertos y los espacios bajo techo. Les recomendamos a las personas en Filadelfia el no viajar a zonas con alto número de casos. Les recomendamos a las personas que han viajado a Filadelfia desde zonas con alto número de casos el mantener una cuarentena por 14 días tras su llegada a Filadelfia. Tenemos un mapa con estas zonas que está publicado en nuestro sitio web fila.gov/COVID-19. Vamos a avanzar a la fase verde, pero esto no significa que la pandemia haya terminado. Muy por el contrario, todo lo que estamos viendo en otros estados e incluso en partes de Pensilvania nos muestra que este virus continúa propagándose. Podemos hacer este paso y permitir actividades adicionales gracias a nuestra orden del uso de máscaras o cubiertas faciales. Pero si las personas no cumplen con la norma, nuevamente nos veremos obligados a agregar restricciones adicionales. También hemos hecho ajustes a las actividades que sí se permitirán el día viernes 3 de julio. No se permitirá la reanudación del servicio en interiores de los restaurantes. Tenemos 4.200 restaurantes en Filadelfia, así que el riesgo es demasiado grande. Permitir esto sería permitir que las personas se reúnan en espacios cerrados sin máscaras y esto podría provocar un brote peor que el del mes de abril o incluso peor. El número de muertes pudiera aumentar y el sistema hospitalario podría colapsar y todo esto nos obligaría nuevamente a cerrar la ciudad. Tenemos que ser cautelosos ahora porque si no, como Florida y Texas, lo lamentaremos en el futuro. Todavía está permitida la operación de los restaurantes bajo la modalidad de entrega a domicilio, recogida de comida en el establecimiento y su consumo al aire libre. También se va a suspender la reapertura planificada de los gimnasios. Hay pruebas de que esto puso en riesgo a los habitantes de otros condados en Pensilvania. Nosotros promovemos el ejercicio, pero cuando se hace al aire libre. Es probable que esta pausa quede vigente hasta el 1 de agosto, pero vamos a evaluar las tendencias semanalmente y vamos a reconsiderar ciertas medidas según vaya evolucionando esta epidemia. El día 3 de julio pasaremos entonces a una fase verde modificada y restringida. Vamos a permitir algunas actividades de bajo riesgo en la fase verde con ciertas restricciones de seguridad. Vamos a permitir actividades que puedan realizarse al aire libre o donde se pueda usar y hacer cumplir el uso de las máscaras. Van a volver a abrir los museos y las bibliotecas, los centros comerciales bajo techo y los casinos, siempre y cuando cumplan con los siguientes requisitos: el uso de máscaras, el respetar la distancia social, quedando absolutamente prohibido el servicio de toda comida, bebida y el fumar en los interiores. También las reuniones en interiores con menos de 25 personas serán permitidas, así como las reuniones al aire libre con más de 50 personas. Todas las actividades deben seguir las directrices del modo seguro, y esto incluye el uso universal de mascarillas, la reducción de las multitudes y el cumplimiento con la distancia social. Hemos estado trabajando también directamente con las escuelas y las universidades en torno a sus planes de reapertura. Les recomendamos a todos los que puedan trabajar hacerlo de retroceso y al cierre de muchas actividades si el número de casos fuera a aumentar. Tenemos que ser realistas. Vamos a estar viviendo con este virus por un largo tiempo. No eliminaremos el coronavirus, nacional o localmente, hasta que tengamos una vacuna. Afortunadamente, muchos de los casos presentan una infección leve o media y se recuperan exitosamente. Y nuestro sistema hospitalario está preparado para ofrecer el tratamiento. Si no podemos eliminar el virus, debemos proteger, sin embargo, a los más vulnerables. La tercera parte de nuestra estrategia consiste de la contención, el reforzamiento de la distancia social y la protección de las poblaciones más vulnerables. Hemos estado trabajando y continuaremos haciéndolo con los hogares de ancianos y con los entornos congregados. Pero hay mucha población vulnerable en Filadelfia. Las personas entre los 50 y 65 años o cualquier otra edad que puedan tener deficiencias en su sistema inmune o que puedan estar recibiendo tratamientos fuertes, como por ejemplo contra el cáncer. Para ellos, estas son nuestras recomendaciones. Permanezcan en casa. No salgan a la calle para hacer diligencias que no sean esenciales. Los familiares que vivan con estas personas deben estar en casa el mayor tiempo posible. Use una máscara y haga que los miembros de su familia y las personas que los cuidan usen máscaras también cuando no puedan mantener la distancia social dentro de su hogar. Nuestro llamado es que por favor nos ayudes a frenar esta epidemia. Usa una máscara al salir y mantén la distancia social todo el tiempo. Solo trabajando juntos podremos sobrevivir esta crisis. Muchas gracias.
Thank you, Armando. We will now move to our Q&A portion for members of the media. Please remember that due to time constraints, only one representative from each media outlet is permitted to ask questions. Reporters are asked to limit their questions to 3 or fewer, and we will do a second round of questions if time permits. For members of the press logged in today, please use the raise your hand feature that can be found under the participants list. We also ask that you use video to ask your questions if you are able for broadcasting purposes. And we will now unmute reporters one by one to ask questions, starting with Mitch Blocker of NBC 10.
Good afternoon. Good afternoon, Dr. Farley. Can you explain a little bit of your decision process and whether or not this was a difficult decision to press pause?
It is a difficult decision because we are concerned about the economy of Philadelphia and the social effects of that and the health effects of the social effects. As I said before, the virus kills, but poverty kills too. So we want to get our economy going as much as we can, but we don't want the virus to resurge. So it's always a tough balancing act. And we feel like this is the right decision at this point, but it's something we're going to have to continue to evaluate as we go forward.
How did your regional counterparts and even the Secretary of Health, Dr. Levine, respond when you told them about your decision?
That they respected our decision. They recognized that Philadelphia is different from the rest of the state, and this is an appropriate decision for us. And they, like us, are going to have to constantly reevaluate their policies in their jurisdictions.
If you could give some advice, you talked about Texas and other states influencing what's going on up here potentially. If you could give some advice to your counterparts in Texas and Florida, what would you tell them?
Well, I'm sure that local health directors across Texas and Florida are very unhappy about what's happened. That they probably were forced to reopen things sooner than they would have wanted to. And so I would simply say that, do the best you can to save as many lives as you can. The message to the larger country is that this virus is not going away. It's not that nothing has changed about the virus. Nothing has changed about human biology since March. The only thing that's going to impact on this virus right now is how we behave. And so we're going to have to behave in a way that prevents the spread from one person to another. And if states have reopened too early, they're going to have to scale back and close down some activities. And other states should think very carefully about what activities they allow to restart.
Thank you, sir.
Thanks, Mitch. We are going to go to Jeff Cole of Fox 29.
Yeah, Dr. Farley, 3 questions if I could. First, Dr. Farley, does this pause mean that the technique of stay-at-home testing and tracing will never allow the economy to fully open in this region or any place else without a vaccine?
I think all of the components of our strategy work together. None of them by itself is going to be able to contain this virus. So testing and contact tracing is important, but that by itself will not totally suppress this virus. The social distancing helps, but that by itself is not going to totally prevent this virus. We have to do everything we can to protect vulnerable populations. So we will not be a fully restarted economy until we have a vaccine.
But it appears that it doesn't just allow what it appears is that it doesn't look like it's going to get us to the point where the economy is going to be fully open enough for folks to really believe that they can survive. In other words, it seems to me that this begins to now cut confidence in the only tools that you have.
Well, I could simply point to examples in Korea and Japan where they have had very consistent mask use and very consistent mask policies, and they've been able to open up much more of the economy than we have, and able to get by with very few cases in their countries. And so I do think that there's a middle ground that we can find where we're not totally opening up the economy, but we can get along. And, I will talk about this more at a future press conference, but progress towards a vaccine is really quite good. I'm very optimistic about the vaccine. We will be deploying a vaccine sometime in 2021. I feel confident about that. And it's possible it would be early in 2021. So it may be 6-8 months from now, we're deploying a vaccine. So if we can get along somehow until that point, then we may be able to still save a lot of lives and keep our economy going and then ultimately get past this.
South Koreans, they tested far more aggressively right from the top than the United States has, though, Doctor. Isn't that right? They were aggressive about testing from the top of this, and so they were able to track better.
They did. They started testing earlier. They had the experience of SARS so that everybody knew quickly what to do, put in place. We were slow off the mark here in this country. It doesn't mean that we can't still learn from them and use those lessons here.
Why casinos and not restaurants? It seems to me they're similar in many ways.
Restaurants, you can't have indoor dining in a restaurant and wear a mask, okay? That you are forced to not have a mask when you're eating. In the casino, our rules are no eating, no drinking, no smoking. You must wear a mask at all times and must keep a distance at all times.
Thank you.
Thanks, Jeff. We're going to go to Annie McCormick with 6ABC. Annie? Annie, I'm showing you as unmuted, but I cannot hear you. Okay, Annie, can you try to unmute yourself one more time? And then if not, we can come back. No, unfortunately, I see you, but I can't hear you. All right, Annie, just one sec. We'll come back. We'll go to Natasha Brown of CBS 3.
Hi, is Brian Abernathy on the Zoom call today?
Yes.
Hi, I just have a few questions for Brian, actually. Brian, we're actually talking a little bit more about the homeless encampment today. Parkway neighbors have launched a petition asking for the encampment to be removed by next Monday. They're trying to accommodate youth baseball in the area. Have you seen this request first, and do you share their concerns as well?
Sure. So we have had a number of conversations with Logan Square neighbors and continue to those conversations with the community. And we do have concerns about the encampment, about the health and safety of those who are currently living there, as well as the health and safety of the community. And of course, for the recreational activity of the kids that would normally use that field. We're in active conversations with the encampment and are looking forward to a resolution and expect that by mid-July. So we may not be able to hit the mark for next Monday, but we certainly recognize that this situation is not something that can go on forever. And we've made it clear that our expectation is that the encampment is removed this month.
Okay, and one other thing, we understand also a portion of the protesters have split off to Housing Authority headquarters on Ridge Avenue in North Philly. Are you aware of that and police measures to contain or remove that group there? And are police being considered for that same kind of action along the Parkway as well?
So PHA, so yes, we are aware. The Housing Authority itself is actually managing the protest on Ridge Avenue. with both their police officers and their management. And so would refer you back to Kelvin, but we are certainly in conversations with the Housing Authority and will support as we can. But it is their property and their policies that are being questioned. For the Parkway encampment, we're certainly we're optimistic that we won't need any police action. I think our conversations have been very productive to date, and we want to make sure that we get services into the encampment and make sure that those folks who are currently staying there have what they need to move on to their next step.
Okay, and one last question, Brian. Thanks. Is there any update on the RFP and selection process for the independent investigator that the city's looking to hire to review the 676 tear gas incident? And is there an update available on how many complaints have been received by the city from citizens complaining of excessive force by police during those protests?
Sure. I don't have an update on numbers of complaints. I believe Inspector Kennebrew was working on that. So we will circle back and make sure that we can provide that number if it's currently available. As far as the RFP, it was posted last week, and we expect responses in no later than Friday. We'll be able to make a selection next week on the consultant.
Okay, that's all I have. Thank you so much.
All right. Thanks, Natasha.
Thank you. We're going to go to Corey Clark of PCN.
Hi, Dr. Farley. Just a question about, first of all, the nomenclature that's being used. You've been saying, talking about moving to green. As far as the state has Philadelphia listed, it says that Philadelphia is in green or modified green. So what status is Philadelphia right now as far as the state is concerned?
I believe the state classifies us as green. However, the governor has been clear, and I've been clear with the governor and with the health department, that we can be more restrictive in green here in Philadelphia than the rest of the state is. And so we are more restricted. So it's a modified restricted green. We're relieving some of the restrictions. Some restrictions that we allowed, we released last Friday, some additional ones this Friday. Some other ones will remain after this Friday. So yes, you can call us green, but there are more restrictions than in green in other parts of the state.
And so it seems like you're keeping things more restricted. So what's the end game for places like gyms, which is kind of worst case scenario, indoor, people are breathing heavily. What kind of benchmark would we have to see in order for something like a gym to reopen?
What we said is that likely this closure is going to continue until August 1st. However, we'll continue to reevaluate. And we're going to look at things like the number of cases in Philadelphia, the trend in the number of cases, as well as the other metrics we had and lay out for our consideration going to green in the first place about how well we're doing contact tracing, for example, and our hospital status. So I can't give you the exact formula, but I can tell you that the more cases rise, the more concerned we are and the less likely we are to reopen things. And we might even think about closing things. The more cases go down, the better we'll feel.
Thank you.
Thanks, Corey. We're going to try to go back to Annie McCormick. Annie, let's see if we can hear you this time.
Hey, can you hear me now?
Yes.
Okay, sorry about that. So I have a question in regards to contact tracing. This is for Dr. Farley. At this point, are you still able to see if those protests that happened now 2 weeks ago in any way have an impact into the rise in cases? And do you think that we'll even get an accurate number since protesters were told by the city they didn't have to disclose that they were at a protest if they did get tested?
We will never be able to say for sure whether those protests led to any spread of the virus from one person to another because we don't collect that information when people come in for testing. I can say that if it were to have caused a substantial increase in spread, I would have expected an increase earlier. We're seeing an increase now, and it appears that this increase now is younger people, more involved in social events. But again, we can't distinguish entirely. So I don't believe that the protest had a big impact, but I'm not sure, and we'll never know for sure.
Also, since indoor dining, gyms, happen now, but if you announce that you're going to have to scale back again even more due to rising cases, what businesses that were allowed to open would be shut down first?
We haven't done an assessment like that. That's something we'll have to look at.
Okay, and then this is a question more for Brian. Now that there's an announcement that indoor dining can't happen, some restaurants we spoke to say that they already made the purchases with a bigger capacity anticipated with indoor dining. Are there going to be any more financial aid packages for those restaurants and businesses that will be impacted by that decision?
You know, we're continuing to review what financial aid we can provide to businesses across the board, not just to restaurants, but all businesses that have been impacted by this crisis. You know, I don't have a great answer to say that, you know, people were planning ahead and made purchases ahead. You know, I think that we certainly understand the difficult position that they're in, but I think we are doing everything we can to make sure our population stays safe and we don't see large spikes like some of our colleagues in other cities and jurisdictions have seen.
Thank you.
We're not hearing you.
Excuse me, Laura McChrystal of the Inquirer, you are up next.
Hi. First, a question for Dr. Farley. You mentioned that some of the new cases seem to be, you know, teens having social gatherings, even going out of state to the Jersey Shore. I'm wondering, in that case, how can we really stop this continued spread if it's sort of happening in places that are outside of like businesses that you have the ability to shut down?
Well, we'll never be able to stop people from bringing the virus from other places into Philadelphia. We can't build up, a wall around the border of Philadelphia. What we can do is to try to reduce the likelihood that once people have it in Philadelphia, that they would spread it to others. And if we do that well enough, then the case counts can continue to go down. But yeah, you're absolutely right that the rest of the country's epidemic will have an impact on us here in Philadelphia.
Okay. And another question as far as bars. I know bars are not open here, but there is the ability to purchase a beverage to go. And the governor had said, that certainly Allegheny County had to close bars. He had mentioned that perhaps bars and people consuming beverages on site after purchasing them was perhaps a problem area that you were all looking at in Philly. Can you comment on that?
I'm not sure exactly what the governor was referring to. I think he may simply have been referring to our, the discussions we had about delaying the reopening of restaurants. And when we say restaurants, we're including bars in that.
Okay. And I know it's only been a few days, but any anecdotal report you can give on how the mandatory mask wearing is going? Do you think people are more likely to wear masks so far as a result?
I don't think you can tell just by, looking around as you walk around the street. I think you need to have hard data on that. We are collecting data on mask use, but I don't have an update on it right now. Maybe next week we'll have a sense for whether there was an increase this week.
Thanks.
Thank you, Laura. We're going to go to Michaela Winberg of Billy Penn.
Hey, everyone. Can you hear me?
Yep.
Okay. I have a couple questions. The first one is for Dr. Farley. Doctor, can you offer an update on Philly's contact tracing program, where we're at with that?
So we have hired and trained, I believe the number is 58 people who do contact tracing. As of a week ago, our software was put in place as people started doing work this week. And what we said is we hope to be fully operational by the end of this week. And so I don't have any numbers for you yet because it's all just being put in place and starting to get data in a database in which we can generate some numbers. But I can tell you that it's absolutely starting.
Okay, thank you. And my second question is for Brian. A lot of people, especially people who've attended protests, are complaining that they see a lot of Philly police officers not wearing masks. Can you comment on why all police officers might not be wearing masks, or if that's something you've noticed, and would you do anything about it?
It is something we've noticed, and it's something that the commissioner has addressed through directives through command staff, and those directives will continue to be made to make sure officers are both protecting themselves, their coworkers, and for the general public.
Okay, thank you. That's all I got.
Thank you. We are going to go to Brian Mendoza now of NBC 10 Telemundo.
Hello guys, can you hear me?
Yes.
Okay. Hola Armando, ¿cómo estás? La primera pregunta es para el doctor Farley, preguntándole específicamente qué tan difícil fue tomar esta decisión de dar un paso atrás y aplicar otras restricciones en cuanto a la fase verde.
The first question is for Dr. Farley. How difficult was it to make this decision to take a step back and apply other restrictions to the entering into the green phase?
The question is, how difficult was the decision to make?
Yes.
It was a difficult decision because we recognize that there are restaurants out there and business owners that need to make a living and employees that they want to employ. We want to get the economy going as well. At the same time, we are very concerned about the epidemic, and we are noticing quite a bit what's happening around the country. We do think on balance this is the right decision, but none of these decisions are easy.
Ha sido una decisión difícil de tomar porque reconocemos que hay restaurantes y negocios como bares que tienen que atender a sus clientes y ganar dinero, pero también nos preocupaba la epidemia y por lo que hemos visto alrededor del país es algo que teníamos que hacer. Ha sido una decisión, pero teníamos que tomarla.
Listo, entonces a cuanto a eso, ¿qué le diría a los dueños de negocios, especialmente restaurantes, que están enojados por esta decisión, ya que dicen se habían preparado comprando mucha más comida y ahora no la van a poder servir a los clientes que iban a atender adentro de sus negocios?
What would you then say to business owners, especially restaurant owners, who are angry about this decision because they had prepared themselves by getting extra food to serve their clients and are not going to be able to do that?
Well, first I would say you have my sympathies. I appreciate this, and I know how difficult it is. We did say that we would go to green if we met certain targets, and we laid out certain targets, and we're not meeting our targets. So we tried to be as clear as possible that this is decisions that are not guaranteed. And unfortunately, in the epidemic, we have to deal with this uncertainty, all of us. It will be uncertain in the future. We will continue to make decisions that we in the future that we can't predict today. So I am very sympathetic. I want the businesses to be open as much as anybody. At the same time, I think officials that allowed restaurants and bars to open up in Florida and Texas are regretting it right now, and I don't want us to be there in the future.
Primero, ante todo, quiero decir que tienen mi compasión los propietarios de negocios, porque habíamos dicho que iríamos a la fase verde solo si satisfacíamos ciertos objetivos, pero no hemos podido lograrlo. Y quiero que quede claro que toda decisión que se toma no tiene ninguna garantía con ello. Enfrentamos mucha falta de certeza en lo que vaya a suceder hacia el futuro y las decisiones que tomamos no podemos predecirlas de antemano. Tienen, como digo, mi compasión y me siento muy mal por ello, pero no queremos reabrir negocios de una forma prematura como lo han hecho los oficiales en Texas y en la Florida y están arrepentidos de hacerlo ahora.
Listo, y la última pregunta. ¿Se tiene planeado en posiblemente implementar restricciones estrictas en cuanto a vuelos entrando a Filadelfia de estados como Texas y la Florida que han sido impactados por un alza de casos?
My last question is also for Dr. Farley. I'm wondering if you're planning on having strict restrictions or implementing some other restrictions for flights entering Philadelphia from states where there's been an increase in cases such as Texas and Florida.
We don't have the ability that I'm aware of to be able to restrict flights, but we are making recommendations that people who come in from high incidence states like Florida and Texas self-quarantine for 14 days after they arrive here so that if they develop the infection, they don't pass it on to local people.
No creo que contemos con la capacidad de imponer restricciones a los vuelos que lleguen, pero sí podemos emitir recomendaciones y la que estamos emitiendo ahora es a las personas que vienen de estados como Texas y Florida, que han tenido un repunte en el número de casos, que mantengan la cuarentena y que mantengan restringidos de circulación por 14 días, al menos.
Muchas gracias, Armando.
Por nada, Brian. Thank you.
Thanks, Brian. We're going to go to Mike D'Onofrio now of the Tribune.
Sure. Can everybody hear me?
Yes.
All right. Let's see. Have there been any outbreaks of the virus in public housing facilities? And would you have any figures or numbers to go along with that, like the number of people who've tested positive? And are you closely monitoring, say, any facilities?
We don't have data on public housing facilities, so I can't answer any of those.
All right. Does it concern you that you don't have any figures or you're not tracking any of that?
Well, we're less focused on where people live than what activities they participated in, which might put them at risk to acquire or to spread the virus. So someone who lives in a public housing apartment building is really no different from someone who lives in any other apartment building. So we are trying to get better information on the setting for transmission. But again, the public housing is not really, it's not the public nature of housing as it is just someone's, their household conditions or the social activities or their occupational activities. It's important.
All right. And I don't know if you said this in the beginning, I missed the first minute or two, but what targets does Philadelphia actually need to meet in order for you and city officials to move it fully into the green phase?
If you go to our website, on our green plan, we lay it out a series of targets. There's about 8 different targets that have to do with the number of cases that are occurring per day, the rate of change of those number of cases, our hospital capacity, our contact tracing numbers. If you look at those, you'll see all those targets. 2 of them right at the top, we did not meet, and that's our daily case count, and the other is the change in that daily case count.
All right. And I haven't attended these for a while, but is the administration revealing any figures about how many police officers have tested positive?
No.
No, still no? Any update on why you're not doing that? Are you seeing large numbers, even without giving numbers? Are you seeing many calling out?
Mike, so no, we have not seen large numbers. And as I said, and we're happy to refer you back to those comments about why. I'll go back a month or 2 ago from that press conference. We'll send that to you. But, I said then, and I will say now, that if we had any indication that we had or had a public safety issue, we would certainly tell and inform the public. We do not have a public safety issue related to police officers or firefighters calling out for COVID-related illness.
All right. I guess just lastly, are you seeing any outbreak of the virus in the encampment in front of the art museum or on the Ben Parkway?
No. So we did do we did have everyone there tested, actually at their request. Those tests were provided. To my knowledge, we didn't receive any positive results from those tests. If there were positive results, it certainly wasn't widespread.
All right. That's all I got. Thanks.
So Mike, we're going to go to Nina Feldman now of WHYY.
Hi, thank you. 2 questions. Dr. Farley, this is sort of piggybacking on an earlier question about the naming of the phases. Are you concerned that there might be any confusion by saying that we are going green when almost all of the restrictions are staying in place, that, and you explicitly said we haven't met the targets that we were hoping to meet in order to go green. And it just seems a little confusing to say we're still going to green when we haven't met those targets. So I'm just confused a little bit about that name and why the decision was still made to call it going to green.
So the governor came up with this high-level plan with these 3 different colors, but clearly Philadelphia is unique. That's a statewide plan. And so in the governor's categorization, Philadelphia has gone to green. However, we have additional restrictions. We feel we need to protect people. So we're calling it green, but I would rather have people focus less on the color and more on what activities are allowed and what are not allowed. And even more important than that, what restrictions are on how these activities are allowed. There's a lot that we can do safely if people follow the masking, distance, barriers, et cetera, rules. If people focus on that, we can do a lot. But we will continue in Philadelphia to restrict things we feel are necessary to protect people in Philadelphia's health.
That makes sense. I still am just a little confused, though, because the state already has Philadelphia County listed as green, but then the city is making a determination for Friday, July 3rd, which is restricted green. So that just, if most of the things that we were going to allow in green aren't going to be allowed, then why call it green?
Well, many will be allowed, and some of those were allowed as of last Friday, but there are many other ones, such as the indoor malls, such as museums and libraries. So I would say of the things that the governor listed under green, most of them we are allowing. They may be more restricted in the way that they take place, but most of them we are allowing.
Okay. And then my other question is about, on the website, there are a couple of early warning systems listed for how to detect if the virus is surging. And I know, we've only seen slight average increases over the last, 7-day increases, but I wondered if either of those, the temperature checks at home or the flu-like symptoms presenting in hospitals, not even hospitalizations for COVID, but just those flu-like symptoms presenting in hospitals, if you've seen upticks in either of those departments.
We have not seen increases in either one of those, which is a good sign. The one thing we are seeing is the increase in the number of cases reported to us, that's very important in its own right. But the other ones, thankfully, are not showing an increase.
Okay, thanks.
Thank you, Nina. We're going to go to Argenis Figueroa now of Univision.
Hola, buenas tardes.
Buenas tardes, Argenis.
Buenas tardes, Armando. Armando, mi pregunta es para el doctor Farley. Entendiendo que no se permitirá el servicio adentro de los restaurantes por el riesgo, ¿han pensado en restringir el servicio afuera si la situación empeora?
The question is for Dr. Farley. Given that you consider not allowing indoor service in restaurants, have you considered also in placing restrictions on outdoor service in restaurants?
We do think that the risk outdoors is less than the risk indoors. And so at the moment, we are not restricting outdoor dining, and we're hoping that we can continue to do that safely. And that's a way for restaurants to continue to operate their business in a way without increasing the spread of the virus.
Por el momento pensamos que existe un menor riesgo en el servicio al aire libre en los restaurantes y no estamos pensando en restringir ese servicio con la esperanza de que se continúe atendiendo a sus clientes afuera con las medidas de seguridad observadas.
Ok, gracias. Armando, la otra pregunta es para Brian. Solo queremos saber si la ciudad ha pensado en imponer multas a las personas que no estén usando las mascarillas en público. Ayer hicimos un reportaje y muchos dueños de negocios nos decían que hay todavía muchas personas que no la están usando y eso les causa problema a ellos también.
My question is for Brian now. We would like to know if the city is thinking of imposing fines for people not wearing the masks in public. We have reports, we had one yesterday, of business owners complaining that their job is made more difficult because people are not abiding by the recommendations and wearing the masks.
And I think Dr. Farley covered this earlier. We're not intending to issue fines for not wearing a mask. We'd rather provide masks to the public and educate the public than try punitive measures that will have a disproportionate impact on our poor populations.
Creo que el Dr. Farley lo mencionó anteriormente. Nosotros en estos momentos no estamos contemplando la imposición de multas. Lo que queremos hacer es proporcionar las mascarillas a la gente y educarla sobre su uso. No creemos que las medidas punitivas funcionen y pueden resultar algo contraproducente, especialmente para las personas que no tienen medios.
Okay. Muchas gracias, Armando. Es todo.
Por todo. Muchas gracias. Thank you.
Thank you. We're going to go to Pat Loeb of KYW now. Pat?
Dr. Farley, one of your targets was hospital capacity. Can you tell us if there's been an improvement there?
There has been. I don't have the exact numbers, but I believe we only have about 15% as many people with coronavirus in Philadelphia hospitals now compared to where we were at the peak of the epidemic in the middle of April.
Okay, that's correct, because last week it was like 25%, so you are seeing a decrease in seriousness.
Yes.
Okay.
Yes.
You think that's because the people getting it now are younger?
That's number one, and also, hospitalizations is a lagging indicator. It takes a while for people to get sick enough to be in the hospital, and so when we're seeing positive test results, that's kind of a leading indicator. So I'm glad that hospitalizations are lower, but I worry that if case rates start to rise, that a couple of weeks later we are going to see an increase in hospitalizations too.
Thank you. And Brian, I wanted to follow up on somebody else's question from earlier, actually. When did a directive go to police about masks? Were they not ordered to wear masks all the time right from the beginning?
Yes, they were. And that they have been reminded on a number of occasions. So that will, on a regular basis, orders are provided at roll call. This was one of those orders, and it's been, at least from my understanding, provided on more than one occasion. So we'll certainly circle back with commanders again.
Because that sounds like, they're insubordinate.
Understood, Pat, and I think we will, again, continue to follow up with the police officers and make sure that they are following appropriate protocols.
Thank you very much.
Thanks, Pat. We're going to go to Jack Tomsick now of Metro.
Yes, this question's for Dr. Farley. You talked about maybe trips to the shore being connected with an increase in case. How were you able to tell how were you able to make that connection?
Well, as part of contact tracing, we are interviewing people with the infection. Not everybody yet, but definitely a percentage of them. And we pick up common things that they report. And a number of them are reporting trips to the shore.
And have there been any specific events, that have, you think, led to this increase at the shore, or is it just a general thing?
What we're hearing is many people living together at a beach house or socializing together at bars or restaurants.
All right. Thank you.
Thanks, Jack. We're going to go to Brian McCrone of NBC 10 Digital.
Hello there. I want to double check on a couple things. So did hair salons, barbershops, and spas, they were allowed to reopen last Friday, the 26th, correct?
That's correct.
Does this pause affect any of those businesses that last Friday that were open, their operations at all?
No, as of now, we are not closing any activities that have already been opened. We are just pausing on some of the activities that might have opened in the future. Okay.
And then I think it was touched upon earlier, but I don't know if it was answered directly. So the state lists, or fully, the state lists Philadelphia County as green, but the county itself is. So you guys are saying you're not moving completely to green. Does that affect any of the enforcement ability of the city legally?
I don't believe so. No, the city has the ability to be more restrictive than the state, practically speaking, and I believe legally speaking.
Okay. Yeah. Okay. So then, a defiance of the order, you can still enforce penalties, is what you're saying.
The city cannot be less restrictive than the state, but it can be more restrictive than the state.
Okay. All right. Okay. Thank you. That's it for me.
Okay, thank you, Brian. We're going to go back to Mike D'Onofrio with the Tribune.
Hey, it's 2 questions. Do you think that the police commissioner intends to, or would the administration endorse disciplining any officers who continue to buck the mandate to wear masks?
I think we don't want to get to that point. And so we'll continue to work with our officers to make sure that they are protecting themselves, protecting their colleagues, and protecting the public.
And maybe lastly, what message do you think it sends to residents and people that they're supposed to be protecting, that these officers continue not to wear masks, even though they've been told to do it?
I share those concerns, but I think it also, our police force is a microcosm of our society. And certainly, just like members of our society don't want to wear masks, I have officers that don't want to wear masks. My job is to make sure that they figure out how to, that they need to. And that is going to be the message that continues to go out to the department.
Okay, thanks.
Okay, that concludes all of our questions for today. Thank you for joining our briefing. We will be back at 1 p.m. on Thursday. Thank you.